NLN Pre-Nursing Entrance Exam Questions. Question 1. Which weight in pounds is closest to 55 kilograms using 1 kilogram equals 2.2 pounds in this online quiz item? Option A, 121 pounds. Option B, 25 pounds. Option C, 57.2 pounds. Option D, 1,210 pounds. The correct answer is option. Multiply kilograms by 2.2, so 55 times 2.2 equals 121 pounds. The other choices divide instead of multiply, add the conversion factor, or move the decimal one place too far. Question 2. During a quick next review of a answer key item, which word is closest in meaning to accurate in a science paragraph? Option A, rapid. Option B, casual. Option C, distant. Option D, correct. The correct answer is option. Accurate means correct, so that choice matches the meaning in context. Rapid means fast, not correct. Casual means informal, not correct. And distant means far away, not correct. Question 3. After checking the choices in a sample test item, which answer identifies the process moves water across a semipermeable membrane? Option A, osmosis. Option B, exocytosis. Option C, transcription. Option D, mitosis. The correct answer is option. Osmosis is the diffusion of water through a selectively permeable membrane. Exocytosis moves materials out of a cell, transcription copies DNA information into RNA, and mitosis is cell division. Question 4. If a test bank stem gives one clear clue, which statement gives the best main idea of this passage? A school added quiet study rooms, and students reported fewer distractions. Option A, students no longer needed to study. Option B, reducing distractions can improve study conditions. Option C, quiet rooms increase noise. Option D, distractions are always helpful. The correct answer is option. The result directly connects quiet rooms to fewer distractions. Students no longer needed to study is not supported by the passage, quiet rooms increase noise is not supported by the passage, and distractions are always helpful is not supported by the passage. Question 5. When time is limited on a skill practice question, which critical thinking response best fits this situation? A graph rises sharply after a policy change, but no other information is given. Option A. A rising graph proves the policy caused everything. Option B. The graph shows a possible association but does not prove causation by itself. Option C. Graphs cannot show patterns. Option D. The policy must be ignored. The correct answer is option. A time pattern can suggest a relationship, but causation requires stronger evidence. A rising graph proves the policy caused everything does not follow from the situation. Graphs cannot show patterns does not follow from the situation, and the policy must be ignored does not follow from the situation. Question 6. Given the information in a learning module item, which number is 40% of 300? Option A, 340. Option B, 120. Option C, 260. Option D, 1,200. The correct answer is option. 40% means 40/100, so 300 times 40/100 equals 120. The other choices come from adding or subtracting the percent, moving the decimal incorrectly, or dividing in the wrong direction. Question 7. Suppose a similar structured test item appears on test day. Which word is closest in meaning to a parent in a science paragraph? Option A, obvious. Option B, temporary. Option C, hidden. Option D, minor. The correct answer is option. Apparent means obvious, so that choice matches the meaning in context. Temporary means brief, not obvious. Hidden means concealed, not obvious. And minor means small, not obvious. Question 8. While working through a timed full practice set, which answer identifies the tiny air sacs exchange oxygen and carbon dioxide? Option A, villi. Option B, bronchi. Option C, nephrons. Option D, alveoli. The correct answer is option. Alveoli provide thin, moist surfaces where gases diffuse between air and blood. Villi absorb nutrients in the intestine, bronchi carry air toward the lungs, and nephrons filter blood in kidneys. Question 9. Before choosing an answer in a nursing entrance item, which statement gives the best main idea of this passage? A report says infection rates fell after staff completed a hand hygiene refresher. Option A, hand hygiene cannot affect infection. Option B, a training increased infection rates. Option C, the refresher removed all risk permanently. Option D, a training may have improved compliance with hygiene practices. The correct answer is option. The sequence suggests training supported better hygiene behavior. Hand hygiene cannot affect infection is not supported by the passage, training increased infection rates is not supported by the passage, and the refresher removed all risk permanently is not supported by the passage. Question 10. A student sees this pre-nursing prep idea on a next review, which increase is shown from Monday 15 to Wednesday 25 in a simple practice chart? Option A, 40. Option B, 7. Option C, 25. Option D, 10. The correct answer is option. The increase is the final value minus the starting value, 25/15 equals 10. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference. Question 11. One verbal practice problem tests this skill. Which probability describes drawing a red card from a set with 4 red and 5 blue cards? Option A, 9/4. Option B, 5/9. Option C, 4/5. Option D, 4/9. The correct answer is option. Probability is favorable outcomes divided by total outcomes, so the result is 4/9, simplified to 4/9. The other choices use blue cards, compare red to blue only, or invert the fraction. Question 12. Several choices look tempting in a math practice item. Which word is closest in meaning to clarify in a science paragraph? Option A, damage. Option B, explain. Option C, measure. Option D, confuse. The correct answer is option. Clarify means explain, so that choice matches the meaning in context. Damage means harm, not explain. Measure means determine size, not explain. And confuse means make unclear, not explain. Question 13. For this science practice nursing entrance question, which answer identifies the chemical messenger released by endocrine glands? Option A, enzyme. Option B, platelet. Option C, antibody. Option D, hormone. The correct answer is option. Hormones travel through the bloodstream and affect target tissues. Enzyme speeds chemical reactions, platelet helps clotting, and antibody targets antigens. Question 14. In a short biology review practice STEM, which statement gives the best main idea of this passage? A clinic sends appointment reminders, and missed visits decline. Option A, reminders caused more missed visits. Option B, patients cannot benefit from reminders. Option C, appointments no longer need scheduling. Option D, reminders can help patients remember appointments. The correct answer is option. The decline in missed visits supports the role of reminders. Reminders cause more missed visits is not supported by the passage. Patients cannot benefit from reminders is not supported by the passage, and appointments no longer need scheduling is not supported by the passage. Question 15. Among the choices in a chemistry basics item, which answer identifies the transfer of heat through direct contact? Option A, conduction. Option B, evaporation. Option C, radiation. Option D, convection. The correct answer is option. Conduction transfers heat when particles collide through direct contact. Evaporation is liquid changing to gas, radiation transfers energy by waves, and convection moves heat through fluid circulation. Question 16. Using the facts in a critical thinking question, which milliliter amount equals 0.75 L? Option A, 7,500 ml. Option B, 75 ml. Option C, 7.5 ml. Option D, 750 ml. The correct answer is option. 1 liter equals 1000 ml, so 0.75 times 1000 equals 750 ml. The other choices use 10, 100, or 10,000 as the conversion factor, which shifts the decimal to the wrong place. Question 17. Based on the clue in a comprehension drill item, which word is closest in meaning to contrast in a science paragraph? Option A, difference. Option B, object. Option C, similarity. Option D, schedule. The correct answer is option. Contrast means difference, so that choice matches the meaning in context. Object means thing, not difference. Similarity means likeness, not difference. And schedule means timetable, not difference. Question 18. Consider this high-yield reading skill concept. Which answer identifies the cell division that produces gametes? Option A, mitosis. Option B, translation. Option C, diffusion. Option D, meiosis. The correct answer is option. Meiosis reduces chromosome number and produces sperm or egg cells. Mitosis produces identical body cells, translation builds proteins, and diffusion moves particles down a gradient. Question 19. Near the end of a vocabulary skill review session, which statement gives the best main idea of this passage? A study found that students who practiced with timed sets felt more comfortable during the actual exam. Option A, comfort never changes with practice. Option B, timed sets remove all content gaps. Option C, timed practice can build exam familiarity. Option D, the exam has no time pressure. The correct answer is option. The passage connects timed practice with increased comfort. Comfort never changes with practice is not supported by the passage. Timed sets remove all content gaps is not supported by the passage, and the exam has no time pressure is not supported by the passage. Question 20. Across similar grammar skill nursing entrance questions, which critical thinking response best fits this situation? A patient says, "I feel better, so I stopped the medication early," in a health literacy passage. Option A, medication should always be stopped early. Option B, the statement shows a need for clearer teaching about completing treatment. Option C, teaching is unrelated to medication use. Option D, the patient fully understood the instructions. The correct answer is option. Stopping early can be unsafe depending on the medication and condition, so teaching is needed. Medication should always be stopped early does not follow from the situation. Teaching is unrelated to medication use does not follow from the situation, and the patient fully understood the instructions does not follow from the situation. Question 21. Since only one choice fits the algebra skill clue, which sum equals 1/6 plus 1/3? Option A, 1/4. Option B, 1/3. Option C, 1/2. Option D, 1/6. The correct answer is option. The denominators are already the same, so add the numerators. 1 plus 2 equals 3, then simplify to 1/2. The other choices subtract the numerators, multiply parts of the fractions, or change the denominator unnecessarily. Question 22. From the information in a data interpretation item, which word is closest in meaning to diminish in a science paragraph? Option A, decorate. Option B, repeat. Option C, decrease. Option D, to increase. The correct answer is option. Diminish means decrease, so that choice matches the meaning in context. Decorate means adorn, not decrease. Repeat means do again, not decrease. And increase means grow, not decrease. Question 23. At a testing desk during a reasoning drill review, which answer identifies the solution with pH above 7? Option A, basic. Option B, acidic. Option C, neutral. Option D, hypotonic. The correct answer is option. A pH above 7 indicates a basic or alkaline solution. Acidic describes pH below 7, neutral describes pH 7, and hypotonic describes lower solute concentration. Question 24. Inside a timed practice science or skills item, which inference is best supported by the passage? A patient education sheet used short sentences, headings, and pictures. Option A, pictures make written instructions unnecessary. Option B, headings reduce the value of information. Option C, clear formatting helps readers understand health information. Option D, long paragraphs are best for patient teaching. The correct answer is option. The sheet is designed to improve readability and comprehension. Pictures make written instructions unnecessary, is not supported by the passage. Headings reduce the value of information, is not supported by the passage. And long paragraphs are best for patient teaching, is not supported by the passage. Question 25. Through careful reading of a score report STEM, which increase is shown from Monday 14 to Wednesday 22 in a simple practice chart? Option A, 22. Option B, 5. Option C, 8. Option D, 36. The correct answer is option. The increase is the final value minus the starting value, 2214 equals 8. The other choices use the final value alone, only the Monday to Tuesday change, or the sum instead of the difference.